morning, everyone. It's Friday, and that means it's time for the Henry County Health Center's FYI. This morning we have Todd Rawls with us, who's the Anesthesia and Pain Management Director at the Henry County Health Center. Good morning, Todd.
Good morning, Mount Pleasant.
You were saying you had to do that when you got on air. So.
Well, you know, I think of the movie. I'm sitting here on the radio, the mics. I'm thinking of Robin Williams and Good Morning Vietnam, but I don't have his panache. So.
Well, we're glad to have you in studio to talk about anesthesia and pain management because, of course, National CRNA Week is next week, January 24th through the 30th.
That means Rob Gardner provides us a parade and buys us lunch every day of the week.
Oh, wow. That's fancy. Hopefully it's like prime rib or something really good.
Absolutely.
Explain what a CRNA is and why they're so important in healthcare.
CRNA stands for Certified Registered Nurse Anesthetist, and we are advanced practice nurses that specialize in anesthesia. We get called anesthesiologist a lot. That's not wrong, but the anesthesiologist title is typically the physician anesthesiologist or physician counterpart that does anesthesia is an anesthesiologist. We're nurse anesthetist. There's actually our professional association is going through a rebranding right now, and anesthesiology is going to be our anyway. It's muddy waters. We do the same job. We actually, our anesthesia training is we train side by side and do the same training for anesthesia. Our background is different. Obviously, the physician anesthesiologist went to medical school. I went to nursing school and then spent time in critical care before going back doing the anesthesia residency.
So you guys have a really important role when it comes to surgeries, healthcare in general. Talk a little bit about why that's so important.
Well, I like to think we have an extremely important role in the surgical arena, but we also do lots of other things in the hospital. But as far as surgery is concerned, you pick your surgeon. Well, the surgeon is taking care of the problem that you're seeing them for. While you're in the operating room, we take care of everything else. Your heartbeat, your breathing, your blood pressure, everything else. We take care of your pain management during surgery, afterwards. I think we're kind of important.
So you've talked a little about surgical patients. Talk a little bit about maybe those other services that you guys do that's not related to surgery.
We're right now with the COVID, and let me say it's very nice to be here in a booth and actually be with people other than my family that we're conversing and interacting with. But we're very involved with when we have individuals that need intubation or a breathing tube put down for COVID, we're involved in that. And not just for COVID, but accidents, trauma alerts, things like that happen in the emergency room. We provide pain management services for people that come into the emergency room, or even post-surgery patients. If they're in the hospital afterwards, say you have a total joint replacement, we follow those patients in the hospital and take care of their pain needs. Among other things, obviously we don't have labor and delivery anymore at the hospital, but we were very involved in that.
So I know you are one of the CRNAs. I think there's another one at the Henry County Health Center.
I have partner Matt Miller, yes. There's two of us now. There was three, but our longtime resident and anesthetist here in Mount Pleasant was Steve Park, and he up and retired on us in February. So I'm sure he's picking his guitar and drinking coffee at Hy-Vee right now. So,
I have to tell a funny story. My mom had to have back surgery once, and you can't have any fluids or whatever before you have surgery. And she loves coffee, and she was experiencing like a caffeine with headache, and she's like, man, my head is just hurting so bad. The anesthesiologist was like, oh, I can fix that for you, and gave her a little bit of caffeine, and she was on her way.
Yeah, all kinds of little tricks of the trade and everything. And the not to spill the beans or always follow the instructions we give you preoperatively, but that old moniker of not having anything to drink or eat before surgery, still true, but we're studies actually show that you should have some sort of carbohydrate drink. Better outcomes if you do that.
Wow.
Have that within 2 hours of surgery. But again, we'll give you instructions on all that. So,
and I know too from people I've heard, the nausea portion of surgery, that you guys play such a huge role in making sure people don't feel bad, feel sick.
Oh, absolutely. That's one of the quality metrics actually that CMS tracks for us for anesthesia and the hospital and the area. Anyway, something we take very seriously. It's a terrible feeling. Nobody likes to feel nauseous, but it's unfortunately it is a side effect of anesthesia. But there are lots of things we can do to adjust our technique and stay away from things and adapt that to the individual to help prevent that.
So what do you think in your life has the biggest impact on your anesthesia practice and how you do things?
Oh, wow. Well, I'm in my 30th year of healthcare. As far as anesthesia-wise, I guess I'm getting to be one of the old guys now. We do a lot of regional anesthesia now, and we incorporate that into, even if you have general anesthesia for surgery, we incorporate regional anesthesia for pain management afterwards. I learned as a blind technique, meaning you know the anatomy, you go through and you select out nerves, knowing where they are in the body and various techniques. Well, to answer your question, the use of ultrasound now in point of care or right at the bedside has become, it's phenomenal. Now we have, in Henry County Health Center, we are privileged to have one of the only wireless ultrasound bedside machines in the state.
Wow.
And it's just a probe that I can take, and now what we used to just do by blind technique, we can actually see, we can be more precise with medication placement. We can avoid a lot of pitfalls or a lot of complications by just seeing where the medicine is, and we don't have to use as much medicine because we're more accurate. So it's better results all the way around, but it's really revolutionized regional anesthesia.
And so, this sounds exciting, and of course technology has just made the medical field in general, we're getting so much better at things, but what do you enjoy most about being a CRNA and working at the Henry County Health Center?
Oh, it's the people. And it's being in the small town, and actually you're taking care of your friends, you're taking care of your neighbors. You sit next to people at church that, oh, okay, I took care of them just last week. And so it's very personal. And there's also a lot more accountability there. I mean, you don't want your next door neighbor just come home saying, oh, man, he didn't do me right. I was throwing up all night long. So not that it's different at bigger institutions, but it's just it's nice taking care of friends and family. And
sure, too, the doctors that you work with and things like that, you get to know even other staff and coworkers pretty well, too, I would imagine, at the health center.
Oh, absolutely. Absolutely. I play racquetball with, we haven't played for about a year now because of COVID, but Dr. Joe Tansey and I would play racquetball.
Okay.
We'd go play golf. I went flying with Dr. Kent Metcalf the other day. I mean, yes, it's a very cohesive medical staff.
So I know, you're saying you guys have great setup here at the Henry County Health Center, but let's talk about Iowa in general. How many hospitals in Iowa are utilizing, CRNAs?
Great question. Actually, in Iowa, out of 117 community hospitals in the state, 88 of those hospitals utilize CRNAs as their sole anesthesia provider. And that's for surgery, obstetrics, pain management, dentist, podiatrist, 88 out of 117 community hospitals. And out of 99 counties in Iowa, I believe it's 89 of the 99 counties have nurse anesthetists. So most of that is because I think there's 8 or 9 counties that don't have a hospital. So anyway.
Well, I certainly feel lucky and reassured that we have good CRNAs right here at the Henry County Health Center. So if we have any services that we need, you guys have us covered. You'll keep us healthy. You'll keep us alive and get us out of surgery or feeling really good.
Oh, absolutely. We're here 24 hours a day, 365 days a year. And we're here to take care of you during surgery, but also, you know, if you need something in the emergency room or in the hospital, we're around doing lots of different stuff. So.
Well, thank you for everything that you do for the Henry County Health Center, for the citizens in our community and in our county. It's a big job. Like you said, you're on call basically all the time. So we really appreciate it, and congratulations on 30 years, hopefully many more here in Mount Pleasant, and happy CRNA Week.
Oh, well, thank you very much.